Thank you for coming today, and as the oldest of 7, I can tell you I always appreciate the opportunity of not having to be the first one to go. So, before I start with the other part of my slide, I want to talk a little bit about why I got involved in this movement of oral health. Part of my role as a faculty member at a physician assistant program is to teach physical diagnosis, and I would spend considerable amount of time teaching the HENT, and Judy, I think now it's HNOT exam, and we would spend a lot of time. We'd get the pen light out, tongue blade, take a look around, not just at the back of the mouth, but all the way in, the mucous membranes, gingiva, teeth, everything that you're supposed to look at, under the tongue, over the tongue, pull the tongue out with some gauze, put your fingers in there, palpate the lymph nodes. And they would do an amazing job, and we would test them a week later, and they would be able to do it, usually everybody passing. Fast forward, they go out to clinical rotations for a year and spend time with providers, and then come back for their final exam, where we gave them a practical, which was a little bit more complicated. So here's a diabetic patient sitting before you, and they're in there for a routine follow-up visit, do the exam. And they would just go like this. Could you open your mouth? Okay. And forgot all the things that we talked about of the proper exam. And I said, we got to do something about this. We got to engage other folks that have an interest in oral health. And if we could join this movement of the Oral Health Initiative, that we could hopefully have some impact, not just on our students, but on our preceptors, and they'd come back and actually do a full exam when they get to the end of the program, and continue to do that throughout their careers. So I'm going to talk a little bit about the PA role and why we feel like that we can contribute to this movement. Well, we're involved in just about every specialty, and we value interprofessional practice. In fact, PAs have a grounding in IPP. Back from its historical days. We've always had a relationship with physicians. Studies have shown that PAs have generate a high satisfaction and trust with their patients. We have a really focused mission on prevention and health promotion. It's one of the things that we hear about when we interview students. Why do you want to become a PA? So I really want to be able to spend time with patients and talk to them and give them advice about their health. And we have an increasing role in not only as clinicians, but also as change agents within the healthcare system. But specific areas that were related to oral health include our role in screening and risk assessment, understanding the oral systemic connection, educating patients on good habits, smoking cessation, and so forth. PAs get training, at least in our program and many programs, on how to apply fluoride varnish, and also referrals to dental care. So very comprehensive approach to what we can do to have an impact in this really important area. And we have growing numbers as well. There's, according to this slide, 131,000 certified PAs, and I would say by today it's already at 140,000 certified PAs in the country. We do about 8.5 million visits per week, and 449 million per year. We're allowed to write prescriptions in all states and territories, and PAs generally write about 51 to 100 prescriptions per week, and we are continuing to growing. We're up to 238 programs, graduating about 9,000 PAs per year. One of the things that's, I think, really, I wouldn't say necessarily unique, but I think powerful with the PA profession is that all of our primary organizations within the PA profession have come together and embraced this concept of improving oral health through each way that they can contribute. So our American Academy of Physician Assistants in 2016 reaffirmed a resolution that encouraged all PAs to take an oral health screening, prevention, management, and referral as a serious part of their clinical practice. Our philanthropic organizations, the NCCPA Health Foundation and the PA Foundation, have offered many grants to help with this oral health initiatives. We're endorsers of Smiles for Life. We've increased the amount of education in oral health within our programs, and I'll show you some specifics about that in a minute. We've also spread the word through presentations and through our two primary journals, the Journal of American Academy of Physician Assistants and the Journal of PA Education. Also, we've integrated oral health within our national certifying exam and also in many of our continuing medical education programs. This slide shows you the tremendous growth that we've seen in the amount of oral health training within our programs. So beginning in 2018, where we only had about a third of our programs, we've basically nearly tripled that amount of education by 2017, where 96% of the responding programs said that they are including a significant amount of oral health within their programs. So you can see that oral health is really an important part of our educational program. Not only have, and Anita has shown a little bit of this already, but not only do we have the oral health in our education, but it has translated into clinical practice. And so I'm not going to go over all that, the existing data as well, but just suffice it to say that it's not just things that we do at the educational programs and then the students forget about it, but actually that oral health has translated effectively into clinical practice. And we've had a significant impact in PAs actually being and embracing oral health within their practice. Whether those be primary care and even specialty. A lot of times people don't think about specialty practices as a part where we can include oral health, but even a PA that's working in a surgical practice who's doing a pre-op physical can talk to a patient who needs some additional work in terms of their mouth, or they find something as part of their screening examination, and then refer them to dental care as part of not just primary care, but also in a surgical practice. There's some demographic drivers that also inspire us to continue to do more with oral health, particularly in the elderly. And chronic disease will have a significant burden on individuals as well as the healthcare system. I think people have said that all morning and will continue to say that this afternoon and tomorrow. And the slide that you see that Dr. Dye has already shared with you shows that the number of individuals 65 and over will continue to grow. And by 2035, you'll see that crossover where we'll actually have more individuals in that age group will surpass those that are younger. In fact, I did a little bit of a calculation. So 15% of many of us are in that 65 plus category right now. But think about it, in 2035, people like Justin Timberlake will be, I just checked it out, he'll be 64 going on 65. So even the youngsters have to start thinking about this. This particular slide shows, and again, no surprise to you, that as we get older, the amount of disability increases with age as well. And so those disabilities include physical capacity, hearing, visual, dementia. And again, we've already shown some relationships or other people have shown the relationships between diseases and some of these disabilities and its link with oral health. So we have some data imperatives that come out of the fact that we have this need of caring for individuals who are getting older who present with chronic disease and disability. Nearly 19% of adults 65 or older have complete tooth loss. Oral and pharyngeal cancers are often diagnosed very late, which means that their outcomes are not going to be as positive. Nearly 63 million people live in dental health profession shortage areas. There's a significant decrease in dental visits based on race, disability, poverty, geographic region, and population density. Dental conditions such as caries and tooth loss impact nutrition, self-esteem, and general health. All those are what are driving us to do the work that we're talking about at this particular conference. And I think you all know and certainly PAs understand the connection with oral health and disease. Diseases like oral and pharyngeal cancer, diabetes and the link to periodontal disease, poor oral health link to there's a poor oral health and its link to cardiovascular disease, impact on common medications, leading to dry mouth and conditions associated with that, poor outcomes relative to, as we were talking about in the nursing home, aspiration pneumonia, mental health impact of oral health, and vice versa, and the poor link of poor oral hygiene and the use of tobacco products that we know about, both the smoking and smokeless. This slide illustrates just the oral health and systemic connection just with one condition, diabetes. And you can see that somebody who is poorly controlled diabetic will have an increased risk of gingivitis and periodontitis. That could also lead to oral fungal infections, diabetic neuropathy, and that can also impact not just the feet that we often think about, but also oral conditions, decreased salivation. And again, we get into this vicious cycle where diabetes is linked to some of these conditions, and these conditions also make their diabetes worse. So you can see that PAs are really understand that these connections are there and that they need to have some kind of impact on the outcomes of patients by intervening in the ways that they can as healthcare providers. So that leads to some recommended goals. So we feel that interprofessional healthcare teams should work together on behalf of older adults to improve the quality of life and self-image by advocating for public policies that improve oral health access and funding, assessing and effectively treating oral health conditions that impact overall health and well-being, and also educating patients so that they're enabled and empowered to take care of their own issues and diseases to the extent that they can. In conclusion, PAs working in team-based practices are impacting oral health and its sequelae for oral adults or older adults. Patient trust and confidence in PAs position them to have a positive impact on preventive care and outcomes for patients. PAs continue to develop referral networks with dentists and other dental health care providers. And I'm certainly, when I get back to Winchester, I'm going to have a lunch and dine with the dentist program too. Thank you for that idea. Positive oral health initiatives can reduce morbidity and mortality for diseases and conditions that are not directly associated with the oral cavity. Healthcare financing is shifting from fee-for-service to outcomes and quality focus. We need to keep that in mind. and PAs have demonstrated they're able to rapidly respond to new markets and research. So one thing I've always appreciated about our profession in that we are very flexible. Where there's a need, PAs can fill that relatively easy. If seniors are not accessing dental care, but access medical care and other health care providers, we as PAs, physician assistants, and nurse practitioners can be a force in terms of screening and referral, notwithstanding the economic barriers that patients may have. Thank you.